Anyot Adik, National Minister of Livestock and Fisheries, Honorable Ministers of Health, Minister of Animal Resources and Fisheries, Speaker of Northern Baragaza, Mayor from Northern Baragaza, representative from other line ministries, representative from other UN agencies and NGOs, ladies and gentlemen. I am honored today to address this occasion as we mark the World Rabies Day. And I would really like to thank all of you for allocating time from your busy schedules to come and participate in this event. And this clearly demonstrates your commitment to fight and eliminate rabies, among other diseases in South Sudan. Your Excellency, I think the previous speaker has already articulated the burden of the rabies globally and also in Africa. Just to add that the bigger burden of the rabies in the African continent is very, very high. And just for last year, we lost 21,000 colleagues Africans because of rabies. Up to 99% of rabies cases, domestic dogs are responsible for the rabies virus transmission to human. And every year, more than 29 million people worldwide receive post-exposure prophylaxis, which is estimated to prevent hundreds of thousands of rabies deaths annually. This represents only 1/3 of all estimated 100 million dog bites globally. Rabies is a vaccine preventable disease and is in more than 150 countries around the world. Although effective human vaccines and immunoglobulin exist, these vaccines are not readily available to many of our rural people in rural people settings. And also for us to stop the transmission of rabies from dogs to human, we have to make sure that we hit 70% coverage of rabies consistently. And as we have the goal of zero death due to rabies globally by 2030, we have many countries in the developed world, particularly Europe, in Australia, in Japan, in North America, that have actually reached this target. This year's commemoration of the World Rabies Day outside of Juba marks a historical move in our quest to decentralize the multi-sectoral coordination mechanism using the One Health approach to improve health outcome for humans and animals in South Sudan. I'm delighted today to witness the tremendous work that we have done together to establish One Health multi-sectoral coordination mechanisms with high-level political commitment and technical guidance that has led to successful event marking the official launch of the World Rabies Day that we are commemorating here in Northern Baragaza. The World Health Organization is deeply committed to promoting health and well-being for everyone in South Sudan and certainly globally. And I firmly believe that the multi-sectoral coordination mechanism remains a powerful tool to achieve this goal. Despite these notable efforts, there are many challenges, including limited rabies surveillance mechanisms, the weak laboratory system, limited reliable data for us to effectively respond to rabies in the country. We must put One Health into practice and eliminate rabies to achieve the zero death by 2030 by ensuring preventive measures, including vaccine programs, are in place and surveillance and testing for disease and information sharing are strengthened at all levels. Your Excellency, distinguished guests, ladies and gentlemen, Interrupting transmission of rabies is feasible through vaccination of dogs and prevention of dog bites. Despite being entirely preventable, the dog-mediated human rabies kills tens of thousands of people every year, especially in rural and in impoverished areas. And the cost of the vaccines, but also immunoglobulins, are quite expensive. They are estimated to cost more than $100 per dose, which is not affordable to in many of our settings. To mitigate the spread of the rabies, WHO has deployed a course that provide participants with the knowledge about the biology and epidemiology for this neglected zoonotic disease. The package is available on the web, and you can actually download this package. And I would actually encourage our experts to do downloading and actually go through this course that can help to increase your knowledge, but also capacities to respond to this disease. To prevent rabies death in South Sudan, WHO continues to position